Well, guys, thank you for joining us. I'm very pleased to be hosting our very first patient-doctor interview. And we're going to change it up a little bit today. We are going to have a double-sided interview. So I'm going to interview him, but he's also going to be interviewing me so that we can see what the typical questions are and the typical concerns are for a patient that wants to join us in our practice for limb lengthening. This is Franz Birkholtz from Stellenbosch, South Africa at the IOR. Very pleased to be joined by Mr. Brick, whom you might have come across online. And we're going to be spending some time together exploring this world of limb lengthening through the lens of the patient and the lens of the doctor.
Of course. So, question for Dr. Birkholtz. What are the advantages of differences between fit bone and precise nails and each?
Okay, so at the moment in the world, we have two reputable nails for limb lengthening. So the one is the fit bone and the one is the precise. And I would call them families of nails because within each family, there are different subsets of nails. So the precise nail, the one that most of us use and most of us have experience with, is the precise 2.2. Now, this nail has been around for many years, and many hundreds, if not thousands, of patients have been helped with this technology. That's the magnetically actuated nail that is made of titanium and is a real workhorse in this field. They come in different shapes, sizes, and formats, but essentially a really good nail that works very well. The fit bone nail is a stainless steel nail that works in a slightly different way. It works with an electromechanical motor, so electric motor, and it gets charged through a power source from the outside, which then runs the motor and basically lengthens the nail. Now, both of these nails have been used for a long time. Both of them have been used effectively. I think what is exciting for patients at the moment is we're at the juncture where both of these platforms are expanding, and both of these families are getting new members. So the Precise 2.2 or the Precise family, there is the much awaited Precise Max or P Max nail that is apparently being launched imminently, and I'm laughing because we've all been waiting for it for a long time.
2 years now. Exactly.
Exactly. And but it's punted as a more weight-bearing option than the Precise 2.2, and that excites us because that will hopefully mean that we could have less nails bending. And we'll get into the importance of weight-bearing for nails, but it does not necessarily mean that we can have the surgery and go on with our normal lives.
It's not possible.
This is not what that means. But it does give us the confidence that the nail might withstand more forces.
And the safety.
Aspect. Now, if that is the departure point of what we want in a more modern nail, then the Fitbone family are not falling behind. They've actually launched the Fitbone trochanteric nail, which is a slightly longer nail than the previous Fitbone. It's also at least as strong from a bending perspective, but it also has more screw locking options. So that makes it a nail that's more resistant to bending and certainly more resistant to breaking. The Fitbone nails do not have the risk of the crown fracture, which we sometimes see in the Precise nails, which is a rotational failure of the nail. So without getting too technical, both of these platforms now have very good nails that we have access to and which we can deploy safely. The perception out there is also that the Fitbone nails are a little bit less reliable in how they provide lengthening. And my answer to that would be that if you are monitored by a surgeon meticulously every second week, like we do, with meticulous X-ray measurements and so on, that problem is less of a problem because we pick up if a nail is a bit slow and we just increase the rate of distraction. So the question was around the differences between external and internal frames used in limb lengthening and also the advantages and disadvantages. Well, if we go back in history, limb lengthening really started with external frames. Ilizarov was seen as the father of distraction osteogenesis. He created these ring fixators, which were used to gradually pull limbs apart or osteotomies apart, and that would form bone. Lots of interesting stories around that, which we can get into in a different discussion one day. But suffice it to say, he was sort of seen as the father of distraction osteogenesis. There was a guy in Italy called the Bastiani who did a similar thing, but with monolateral frames. And these have become the workhorses in external fixation. Now, the problem with external fixators is, or the benefit is biomechanics and accessibility. So you can control how strong the device is from the outside. And you can also adjust the device from the outside. And it's a very mechanical device, so you can see it working or not working, and you can adjust. The problem is that it needs to be attached to the bone somehow. and that attachment happens through the skin. So you have penetrating devices, either wires or pins, that go through the skin into the bone. And of course, that's a weak spot because that could potentially be a carrier of infection.
Right.
Now, superficial infection in external fixators are quite common, about 30%, but they are of no real long-term consequence. The one we all scared of is deep bone infection, and that is not so common. So that is, of the patients I've had in my practice, I've done about 3,000 or 4,000 segments of external fixation now, and of those I have 3 patients that had bone infection from a pin site where there was bone infection inside where that pin got infected. And of those 3, we were able to turn all of them around with local treatments for osteomyelitis, local antibiotics, debridement, cleaning, all of that stuff. So the risk is low, but it's not zero. And I think that's important to understand. Of course, with internal nails, you eliminate all this complexity of stuff on the outside. You eliminate the need for pins and stuff that goes through the skin. But of course, you lose the ability to control the device from the outside and to see the device from the outside. So that's an element that disappears. And then also mechanically, the frames, especially the circular frames, are for weight bearing. They're tough devices. You can jump out of an aeroplane with them. And people have done that. But with a nail, of course, it's a weaker device. So, and especially in the tibia, because it controls really only one of the 2 bones, there's complexity there. But that's in a nutshell the 2 things. The big advantage of internal lengthening is that we don't have elements that transfix the muscles. So your movement of the joints, your range of motion, maintenance, all of that is a bit easier with internal nails. And then the infection risk is the second.
So I have an extra question to that question. Can you use externals on tibias? On femurs?
On femurs. We use external fixators on femurs quite often for non-unions, for treating malunions, deformities in kids, bone infection treatments, all of these things we use external fixation in the femurs or the thigh bones for. But it's not really indicated in most of our modern practices for cosmetic lengthening because of 2 things. The one is the extensive scarring that they tend to give, and also the fact that they transfix the muscles and you get a lot more complications in terms of joint movement.
So when you say it's more ideal to do externals on tibias and internals on femurs?
For sure.
If it's a combination
if you're going to use a combination, I think that would be the prudent way, is to do the tibias with frames and the femurs with nails. But, as our global community of reputable surgeons grows and our experience grows, I think the internal nails for the tibias become more and more reliable for all of us to actually do. We understand now that we need blocking screws. We understand what the diastasis screws need to look like. We understand distraction rates with a nail versus a frame. So all of these are little nuances that we've developed over time as a collective to understand how to make it safe. But I think any reputable lengthening surgeon should be able to do circular external fixation, should be able to do internal nails. And if your surgeon doesn't have the capacity to do both of those, then you're probably not in the right place.
Yeah, you probably should do more research.
Because this is the type of techniques that the surgeon needs to be comfortable with in order to manage complications. And for a surgeon that says they don't get complications, that's a black.
That's a lie. There's no way. There's no way.
Unfortunately, complications are part of surgery.
Yeah.
It's a bad part of surgery. That's why I've got gray hair. Something we
I can really see it though.
My next question to you is, what is it like to travel across the globe? I won't say where you're from, but to have your legs lengthened, broken in South Africa. So what are the practicalities? How did you find it? How did you find it difficult to make the decision?
So this, like I said, this is a question very unique to this practice specifically because, like any foreign country, you have to make sure you go through the visa process. Because if you're here for longer than 3 months, you're about to receive a ban from a country, which means if you don't want to come back here for in a couple of months or in a year, you gotta get your nails removed. You won't be able to because the ban lasts for 5 years. Some people already got banned, some people didn't. But I would say if you are planning to come here, please get your visa sorted out in order before you come. Like at least a month ahead, I would say it's a good one. And call Dr. Birkholtz, make sure the nails are in stock so you don't have to wait like weeks or months to get a nail because nails aren't always in stock. That's the thing though, so gotta be aware of that. And obviously the semantics of traveling here are pretty typical. There's a driver here which can take you safely from the airport to where you have to be. Or you can call Uber Black, which is also now a great service, which is completely safe and totally fine. Because people have certain kind of, how do you say this? Vision of Africa.
Some preconception.
Because preconception it's like dangerous, like everything is a Johannesburg, which is not true, honestly, at all. Stellenbosch is a beautiful place, very touristy area, very safe, very clean, very beautiful. Lots of vineyards and lots of greenery and such. So yeah, I would say just come. It's worth the travel. I would say it's been a fantastic experience to me.
Thank you.
Yeah.
Yeah, I think the visa thing is very important. We build visa support into our packages automatically. So we do support you with the necessary documentation and all of that stuff. But of course, we cannot issue a visa to you.
Yeah, which still needs to.
If you can do it ahead of time, medical treatment visa is probably the way to go. If you can't get it ahead of time, then you can arrive on your tourist visa and you can take the risk to then extend that once you've arrived. But that is a little bit more risky.
Yeah. Also, there's another method where you can just kind of depart for a week to your country and then go back and extend another 3 months. But the thing is, though, it's kind of expensive and it's kind of a waste of money if you do that. Yeah. It's very expensive, so I wouldn't suggest that because you kind of need the money for the removal.
No, for sure.
It's still like or you could have paid for like another month of or two.
Come back for a holiday, right?
Yeah, exactly.
For sure. Yeah, and then on the Uber thing, I think that's very important. But I think that the nuance there is Uber Black.
Yes,
because that is definitely the highest level of the Uber, and you get what you pay for.
Yeah. And it's not expensive. It's very reasonable priced, and the drivers are very, very professional. The vehicles are way maintained, and you get to want to go completely safe.
Yeah. Yeah, I think safety is a really important one. That's a big concern to many people coming to our country. And, if you look statistically, South Africa is a very unsafe place.
Yeah.
Those statistics often revolve around statistic
The
numbers.
worst places.
Around the worst places. So we have a big gang problem. We have a big drugs problem.
But not here.
And in Cape Town itself, closer to that side of the world, statistically it looks unsafe. But it is located in those areas. So if you move outside of those areas, like Stellenbosch, for example,
Western Cape.
it is the rest of the Western Cape is very safe. And it's a lovely college town. It's got everything you could want. Very safe. We walk around.
Yeah, students walk in the streets in daylight. Everything is fine. Everyone's very happy, smiling. It's just like it's a student town. Yeah.
It's got that vibe. It's a very interesting town because it has some agricultural things, the wine specifically. It's got the students. It's got some innovation related to the university. It's got a tourist population. So it's a really interesting town. And I think one of our secret superpowers in the country is general friendliness. So whether you're speaking to a petrol attendant or you're speaking to an Uber driver or you're dealing with a waiter, people tend to be very polite and very accommodating. Or tend to want to help you.
Absolutely.
Which is not so common in the rest of the world. Right, you got one for me again?
Yes, of course. What are the clinically agreed safe ranges for lengthening for each segment of your bone?
I'm laughing because it depends on which doctor you ask and how much money they want to get from you. Because some of them will tell you what you want to hear. And what you want to hear is that you want the maximum amount of length.
Yeah, but you gotta be realistic. You gotta be sure you're not crippling your client for their desire.
So my take on it is for every patient, their body will give us a certain amount. And that's very difficult to predict beforehand to know how much your body is going to give me. But for most patients, around the 6.5 centimeter mark for femurs, maybe 7, and in some cases 8 centimeters would be possible and would be safe. So anything is possible. The question is whether it's safe and reliable. So for most people, I would say I can almost guarantee you a 6.5. But if we want to go beyond that, sometimes the body doesn't want to allow us to do that. That's on femurs. On tibias, we probably the same sort of argument, but around the 4.5 centimeter mark, maybe 4 centimeters for most people. So 4 centimeters, and we can push that to 5. So if you want to ask me what the maximum is, then it's 8 plus 5. But that is in exceptional circumstances. And the patient that will get 8 on his femurs and 5 on his tibias is quite a rare individual. It's not that common. Maybe I'll ask the question back to you. How much did we get you?
Oh, I got 5.5 on my tibias. I got 7.5 on my femurs because I knew that there's going to be a limit. Yeah, but I had flexibility, and you gave me permission. Yeah. So in my case, I did get kind of lucky. So I managed to push like all the way maximum on my tibias because I think it was like as much as I could have gotten without severely hampering my quad.
No, that was absolutely the maximum that your body gave us to do.
That's why we stopped,
and that's why we stopped the femur a little bit sooner and tried to do a little bit more on the tibia because the tibias were cruising better than the femurs. But that's that individual take on it. But also, you spent a very long time there, so we didn't do it all in one go.
Yeah.
We separated the two surgeries apart, and the journey took some time, which they do. And then the last bone we didn't mention is the humerus. So the humerus is an interesting bone. It's not a very common one we lengthen for cosmetic purposes, although I've done my fair amount. It's an interesting bone because by adding, say, 3 or 4 centimeters on each humerus, you're increasing the wingspan substantially. So the benefit of a few centimeters is actually quite massive because it goes both ways. It goes through both arms.
Dumb question. What bones should you never lengthen?
Now that's a very important one. So for cosmetic purposes, we should never touch the forearm, the fingers, clavicle. Those are the type of bones you don't they do all of that crazy stuff. And the problem is it's always a risk-benefit ratio, right? And even lengthening normal legs is seen as very controversial and very dangerous because theoretically it could kill you in extreme cases.
That's okay.
Any surgery can, for sure. But from a safety perspective, I think if you talk to any reputable limb lengthening surgeon, and there's only really probably about 8 of us around the world, I think, that do a serious amount of cosmetic lengthening. Maybe 10, but not more than that. If you ask any of us, then I think most of us would shy away quite aggressively from clavicles, forearms, fingers, for function and for safety.
Because there's been some discussion of like clavicle lengthening, and it's been like very bad results, essentially, like very painful, very irreversible damage to the human body.
Absolutely. And if you look at the clavicle's anatomy, just behind the clavicle, below the clavicle, you've got the subclavian artery, subclavian vein, and all the nerves that run to your arm. And those things are literally in some places 3 millimeters from the clavicle.
Oh my God.
So you can imagine the tolerance of error to damage one of those things.
It's microscopic.
It's microscopic. And that's just not worth it.
Yeah. It's a very interesting because like some people do want to have like slightly longer wingspan, but the danger of like slightly messing with your nerves is just like so high.
Function is always trumps anything else. Function always trumps cosmesis. So I think what is interesting is we're talking about arms and arm lengthening and wingspan and appearance. It's sort of a discussion around proportions. And essentially you can do a lot in terms of your appearance with how you work on your shoulders, how you put on weight, and how you define your shoulders and your shoulder girdle, because for most of us we can actually improve that quite substantially.
We just exercise
and by doing the right exercise. And then posture also plays a big role. I'm slouching at the moment. If I open my chest, I already add centimeters to my shoulder width. And of course, if I'm a little bit more expansive and a little bit more confident, I project that bigger size. So that's a very big difference from where I was sitting to where I am.
Your frame makes a huge difference based on how you present.
Exactly. So that's also something to be aware of. And I think without getting too fuzzy around the stuff, how you dress, how you carry yourself, your own confidence, the way you speak, all of those things come into play in terms of what your stature is when it's projected to other people. So how do people perceive you? And of course, height is a big component of that.
Yeah, but it's not the only component. It's like a lot.
It comes in a package of other things. And this is the one thing I see with my patients going through this journey. Very often they turn from this individual to this individual.
Because they're confident of their journey.
Self-confidence and looking at themselves in a slightly different way. And I think that's fantastic. That's life-changing to see. And I see it often. I see it in every single patient.
It has happened to me essentially. I changed completely to a different person.
No, for sure. And that's why it's also for me an important burden to carry with the patient to take that responsibility and say, this is what we want to give you. And we know it's going to be a difficult road, and I'm not going to forsake you halfway or leave you halfway. We're going to go through this together. We're going to get to the end result because sometimes you are in the thing, you cannot see the result, but I know where we're going and I will carry you there.
Well, you have 3 years of experience, so you kind of seen it all at this point, I think.
And probably, every possible complication that can happen to a patient I've seen in my lifetime, either from myself or from other places, and I've dealt with most of them. And
I mean, that was a pretty big case.
Exactly, you had quite a difficult road, but in the end, we were able to get you to a fully functional, different person that's living.
Back to sports, back to activities, living life outside, walking as much as I want.
Exactly.
And after that, it was almost soon running. Yeah, very soon running. It was about, I guess, weeks off, but after that, basically full range of motion and full quality of life back to what it used to be. Even better, honestly, because of longer legs.
Exactly.
Yeah.
Well, that's something we didn't script, but I wanted to ask you, was it worth it? Did it change your life in the way that you expected?
Oh, I get goosebumps getting the question actually. Because if I get this question in the past, knowing what's going to happen to me, I would say yes 1,000 times. I would still go through this every single time because I know how different life is on the other side of the surgery. Because the confidence it gives you, the freedom you feel after all of this, it's like it's a different life. You're like you're like a different person essentially. You perceive things in a different way. You're not as scared anymore of the outside. You feel like you can chase opportunities which you wouldn't have taken otherwise because you've been through some things which have kind of changed your perspective on life. And every single time I would say yes. I would say this was absolutely worth it, every single penny. And because thing is though, you can buy a car, you can buy a house, you can buy any expensive kind of jewelry or pants or suit or whatever, but it's gonna decay in value. This only increases value. Right. Because this stays with you forever. This is for life. This is a lifetime change which improves your life significantly. And unfortunate reality is, as much as I want to ignore it, but people do judge you by your height. You can go to a psychologist, you can spend all the money you want on therapy, but it's only going to be a temporary solution. It's going to be in your head for the rest of your life. And for some people, it gets into dark places.
It's like a thorn in the back of your
mind.
it's just like keep scratching.
I'm just scratching. I'm not there. I'm just like why am I not taller? Why am I not tall? Why people don't really see me as a bigger person? Right. Why do people look down on me? Why do I have to look up at people? Like those kind of things that just kind of grind at you every day after day. If you stare into the mirror and you see this person who's like, this is not who I want to be. This is not the person I want to be. And why am I not the other guy? Why am I not the taller? Why am I not my bigger shadow I see when the sun hits my back? Right. And you can see this extended silhouette of yourself. Like, why am I not that guy? But now when I walk, I am that guy. I see that shadow, like, that looks good.
Oh, man.
And that's all awesome. The fears, all the nightmares, like insecurities, they're gone.
Wow.
Basically, all erased from my mind.
That's incredible.
I sleep perfectly like a baby, even with all the stuff happening.
The world is a crazy place.
The world is a crazy place right now, but it's been great. And like I said, I would say 1,000 times yes, I would always go through this process again and again. Because I know the other side is just a different world. It's absolutely worth it.